been admitted.
Nobody wants to come to hospital. People only come when either themselves or their relatives or friends are ill. So it's a frightening time of life anyway. And by nature, hospitals are big buildings with frightening machinery in there. So actually, people come to us when they're at the most vulnerable, feeling most worried, anxious or frightened. Our values of respect, responsibility, honesty and innovation are really important. Treating people how they wish to be treated. Remembering aspects of privacy and dignity and good communication. If we want to continue delivering the best in care, then we've got to keep developing ways to do that, looking for new ways to do things. Little things do make a big difference to patients, so we ask all our staff to continually look for ways to improve what they do, how they care for patients.
I believe in being polite. I believe in communication. I believe in respecting everybody's position and working as a team.
Remembering to be patient-centred at all times, that it's often the little things that really make a difference to people. And I suppose my general attitude is thinking of treating the patients how I'd want my parents, my family, or friends to be treated, how I'd expect to be treated coming into hospital.
Respect's the cornerstone on the service that we actually deliver from the Trust, and the staff, primarily our main purpose here is to offer that respect to both the deceased patients and to the families.
Respect is very important, respect amongst staff and also respect for your patients. You do that by having a smile on your face when they come in, sitting down on an eye-to-eye level with them so that when you're asking them questions you're not towering over them. Speaking to them in a language that they understand.
We're actually respecting the fact that there is a patient at the end of whatever we do, and that is obviously the most important thing of all.
Responsibility is one of the most important things that we have to remember. We're responsible for ourselves, we are responsible for our patients, we are responsible for our colleagues, that we don't do anything to harm anyone.
With the turnover of patients, as they being so high, keeping up to date and things like that and knowing where your patients are, what they're doing, things like that. If you're not taking responsibility for your own patients and then making the step to hand it over to your other teammates and things like that, that again's when mistakes can be made and that's when things go wrong.
Often you may have your individual caseload, but it's thinking about the patients that other people are treating as well. And I'm just thinking of an example of a member of staff being in the office last thing at night, checks the answer phone and there's a message that needed action in there and then. And yes, officially we should have gone home half an hour ago, and it's about being proactive and thinking, actually I'll pick up that phone and make that call because it will matter what I'm going to do, rather than being job's worth about it.
And I think that's one of the sorts of things that the health service does, is we all work together as a team, and even if it's not our primary role, we'll actually try and step into the breach to make sure that the service that we provide is maintained to as much a level as we can, even if it's not perfect.
A really brilliant example of innovation actually is that all the curtains have been removed, which is much more hygienic obviously, and the windows have all been frosted, which is letting a lot more light, but it also gives the patients the privacy that they need.
People in higher places up in the hospital don't really do a lot of the jobs that we do down here, so therefore we know how it works more efficiently. So therefore if we can see something that will make it more quicker or more better for patient care, then we can tell our line manager to whoever so that they can implement it and make patient care more effective and more efficient. So it is very important to come up with new ideas, new innovations, and not be afraid to actually tell people about them.
What we try and say in governance and risk is that it's normally the small things you change that actually have the most effect.
We've started walking patients to theatre now, just to sort of promote the dignity side of things, so that we're not just treating them like they're on a conveyor belt sort of thing, so that we are walking into theatre, promoting their independence, maintaining their dignity, and generally speaking, the response seems to be quite positive to that.
The setting up of the C. diff ward was something that came about because of hospital-acquired infection. It required a lot of hard work, but it's been a really innovative thing, and it really will hopefully benefit the trust.
Honesty is rated very highly, and it should be rated very highly. First and foremost, we're a nurse, we're governed by a code of conduct. We have to be honest. You need to be honest to yourself, with yourself. You need to be honest with your colleagues. You need to be honest with your patient and the relatives.
Whether we are giving patients bad news or telling family as to their near and dear what sort of chance they have or what we can do, what is our limitation, honesty comes everywhere. Even when there is a complication occurs, after all surgical procedures are hazardous, I think honesty comes, again, very important, top of the list.
I think it's crucial for people to be able to make informed choices, to present them with the information in an honest way, sensitively, but so that people can take a lead in their care, and being honest with your colleagues as well, so that we can work together towards the patient having the best experience, that it isn't about professional egos, it's about what's best for the patient at the end of the day.
It's a two-way thing, for us to be honest if we haven't done things right, for the patients to be honest back to us, so that we can sort of move forward and improve matters.
Patients come here to realise that they want the best of care, they want to know why they're here, what they're here for, and what the likely outcome of their treatment is going to be. So they need reassurance and understanding. We work within a multidisciplinary group of people, and obviously we need trust, honesty and compassion and communication with each other.
I don't think I'd be a good nurse if I wasn't honest. I don't think I'd have respect if I wasn't honest, and I certainly wouldn't have the trust of my patients if I wasn't honest.
For 10 days I was in ITU and eventually transferred to the ward, and then was told I needed a liver transplant urgently. And within a month I'd had my transplant, and I cannot speak highly enough of the people that dealt with me, from the nursing staff to the cleaners to the porters. Everybody ferried me about, catered for my needs. One lovely domestic brought me my breakfast and she says, "What milk are you going to have, semi-skimmed or full fat?" I went, "I don't do either." She says, "You must have something, we've got to build you up." I said, "I only have skim milk." "Don't worry, I'll go and find you some." And she came back with a carton of skim milk that had my name on it. And that was, to me, that was above and beyond the call of duty. Just everybody treated me as though I was a star guest, if you like, in a hotel, because from the day I walked over the door, just everybody, nobody could do enough for me.
After I'd been discharged and got back home, like many brain hemorrhage patients, you tend to be very worried. You think it's going to happen to you again. My mum was with me for a lot of that time, and she was very concerned. And Mr. Mayor rang my mum and said, "Look, Mrs. Sheldon, your daughter's going to be fine. Don't worry, this is a normal experience for people who've had this kind of surgery, and she will be fine." So it was a very thoughtful thing of him to do from a very busy day, very busy schedule.
While I was on the liver unit, I was treated with a lot of respect. There was nothing too much trouble for the staff at all. Anything that was wanted to be done was done, and any little problem that I had or was concerned about, it was answered straightforward there and then for me. And again, it's another way of the hospital actually being on a one-to-one basis with the patients and letting the patients know exactly what is going on and not beating around the bush, which I find, to me anyway, it was really enjoyable being able to talk to the consultants on a one-to-one basis and actually find exactly what is wrong with you and what they intend to do. And the way they approach you and put things over, it was really remarkable. It certainly put my mind at rest talking to them about what was a very, very frightening and daunting experience, having to go through it all.
We seen a doctor, we came and sat down with him, and he went through everything, what would happen. how the operation would go, how everything should be okay, but then you get to the but. There is a chance that it may not work. There is a chance, like any operation, something may go wrong. And he was absolutely 100% honest, and it was quite funny because as I went to walk out, he actually says, well, I'll see you next week for your operation. And I found that because he was so honest, I found that quite funny. And I said, yes, I'll be there. And he couldn't have been no more honest, because when I walked out, I knew exactly what was going to happen. And that's what I wanted to know. The staff are fantastic. From the day we walked in to the day we left out, and even now, because I still come on, obviously on a regular basis once a month, they still treat me as a friend, if you like. I mean, you know, you get to know all the nurses by their first names, and it's like a family. And I have to say, you cannot get better treatment. The staff are marvellous, from the nurses to the doctors to the surgeons, everybody involved.
When I was admitted here, I was admitted as a day patient, really. I came into the front entrance and was met by the reception girls. And immediately they took me in hand, told me where to go, told me what to do. And one of them actually said, "It's all right, you'll be all right." I was shaking. An old woman, I'd been in nursing all those years, but I was shaking with fear. I went up to the ward and immediately was taken care of. I felt that they cared about me as a person. They were very busy, but I was told to sit down. I was shown where to sit down. Almost straight away, before I got into bed, I had a meal brought to me. And from then on, the whole experience of being on that ward was of care and kindness. Even the cleaners were friendly, and I was just so impressed. This was nursing as I knew nursing. This was how people should be treated.
Initially, when I came on the ward, I must mention here, I was treated with great respect, in the sense that when I requested I needed the ladies only ward, my wish was granted. I wasn't put in the mixed ward, because I don't know, I come from the culture where I think I would have felt if I got up in the morning and I found some strange man next to my bed. And luckily they had a 6-bedder on the other side, which was ladies only. So I was put there. I was very happy with that. And then as far as the operation itself was concerned, everything was explained to myself and my family, my husband, very well as to what the operation involved. So because of the honesty there, I think I appreciated it, because once I went for my operation, my family, they knew what it involved. So they were all prepared for it as well, if worst came to worst. After my operation, because this operation is very long, it was like I went in on a Friday, which is 13th of February, I had my operation 2004, and I came around, I think, Saturday morning, sometime in the early hours. And I remember the nurse was there, and I still remember up till today, she was stroking my cheek, and I was so amazed to see her. I thought she was an angel. I didn't know where I was or what had happened to me. Just coming round and seeing her face, it made me feel so good. I really for a minute thought she was an angel.